Good morning, members, and welcome to the Safeguarding Special Educational Needs Subcommittee meeting being held on Tuesday, the 1st of July 2025. I can confirm that we're quorate. As you're aware, the public element of today's meeting is being recorded, and those participating in the meeting have given consent to their inclusion. The recording will be available on the City Corporation's YouTube channel following the meeting, and it shall be retained for up to 1 civic year. At the first item, we have apologies. Apologies have been received from Stuart Thompson and Shushil Saluja. Do members know of any other apologies? I note that Deputy Anne Corbett has given notice of lateness. Therefore, we move on to item 2, which is members' declarations under the Code of Conduct in respect of items on the agenda. I've not received any in advance. Does a member have a declaration to declare? Seeing none, we therefore move on to item 3, Chairman, which is the election of Deputy Chair. I've not received any expressions of interest in accordance with the deadline. Does a member wish to declare their interest, therefore, now? Thank you, Deputy Kerry Wilkins. Is that seconded? Thank you, and agreed? Thank you. Therefore, Deputy Kerry Wilkins, being the only member indicating their willingness to serve, is therefore declared Deputy Chairman for the ensuing year.
Feel free to move or stay where you are, Kerry, whatever is. Yeah, stay where you are, yeah. Yes. Yeah.
Thank you, Chairman. We therefore move on to item 4, which is the minutes. These are on pages 7 to 14 of your agenda pack, and these are to agree.
Okay, Kerry, I think it was only you and I who were here last time. Are you happy with the minutes? Yeah, great. Agreed?
Agreed. Thank you. We therefore move on to item 5, which is the Safeguarding Adults Who Are Rough Sleeping or Homeless report. This is for information on pages 15 to 30 of your agenda pack. Thank you.
Great, thank you very much. And I think, Ian, you're going to present this. Chris, I don't know if you wanted to say a word or two first. But no?
No, that's okay.
No, that's fine. Just for members' information, as you probably know, we are kind of in the middle of an adult social care inspection at the moment, and so it's timely that this report has come to us today. It gives us the opportunity to scrutinise, but it also means that we can show to inspectors, should they look at minutes and papers, etc., that there's a safeguarding committee who takes this role very seriously, and I think that's really quite an important message for us to be giving. So over to you, Ian, to
thank you, Chair.
talk us through it.
So this is a report that outlines our support for safeguarding rough sleepers in the city. And when we talk about safeguarding in this report, we look at it in a wider sense. So it does include formal safeguarding inquiries, but also longer term support, the prevention work we do to support rough sleepers and those who go into accommodation to prevent them going back to rough sleeping, and the management of risk in our multi-agency approach and high risk panels. There's a couple of things I think specifically to note on this. I think first is the high percentage of former rough sleepers in accommodation. We have over 50% of our supported living placements are for former rough sleepers, and 38% of our residential care placements are former rough sleepers. I think I don't think there'll be another local authority that has such high percentages. And I would say that's probably down to two things. One is the disproportionate number of rough sleepers that we have in the city, but also I think it's indicative of our response to supporting those rough sleepers and the fact that we do put a lot of time and resources into that. The other thing I'd like to raise is that last year there was a ministerial letter to local authorities and chairs of the Safeguarding Adults Board outlining some recommendations on how we should be safeguarding rough sleepers at a strategic level, and that went to everybody in the country. We reviewed that against our our local arrangements and found that we already had quite a mature system already in place. I think there was one change we made, which was to get Will Norman, who's the head of rough sleeping services, into the Safeguarding Adults Board as a standing member. But everything else we kind of really had in place already, which I think is indicative again of the approach that we have to what is quite a significant issue within the City of London. That's it from terms of introduction, but if anyone would like to ask any questions, I'd be happy to pick them up.
Just on page 22, just out of interest, there's a table that shows the assessment details, and I'm just wondering why people would decline or refer to other agencies. If we can just get some information on that, please.
Yeah, so not everybody will. So when it comes to an assessment, somebody has to consent to it in the first place. And people just don't want to be assessed. Then it would come down to whether they have the capacity to decline or not have the capacity to decline. If they don't, and we're concerned, that we can go ahead without their consent from a safeguarding perspective. But if they do consent, that obviously we'll take it forward. So what was the other comment was on the.
Just referring to other agencies, what that means?
Yeah, sometimes. So for example, it might not reach this sort of criteria. You might not think that a sort of adult social care assessment is the right way forward. So it might be more that this will be a rough sleeping sort of. It might be a sort of a substance misuse approach, or it might be a health-led approach. It might even be a Mental Health Act assessment rather than a Care Act assessment.
Steve?
Yeah, thanks, Chair. I suppose what I'm thinking about, and you actually did say this a little bit in your introduction, Ian, is that obviously rough sleepers move around London, so I suppose a couple of questions. One is, to what extent are we acting as a magnet to rough sleepers because of the services we provide? And secondly, maybe I've got 2A and 2B. Secondly, what work are we doing with other local authorities to make sure that the way in which we're providing services for rough sleepers is shared across those local authorities? And my 2B question is there any evidence that any other local authorities are hinting to rough sleepers that they should move in our direction?
I'll answer that last one first. I'm not aware of any. But to take the first point, I think just remind the first point.
The extent to which we're a magnet.
Yeah, I think the City of London is a magnet because for various reasons. It's a safe place, one of the safest places in the country for people to come in. There's also a large begging economy with the business sector. So I think it's a magnet from that perspective. I wouldn't say it's necessarily a magnet for people to come otherwise for services in the city, because I think people, like many rough sleepers, are trying to avoid services, and we have a very, very sort of high sort of ratio of outreach services in the city. So you're more likely to be sort of found and engaged within the city than you perhaps are with other local authorities. What we do find from the transient population is they sometimes move away to avoid having to engage and can move into different local authorities. And picking up your point, we do very much work with other local authorities. We have a high needs hostel currently in London Borough of Southwark, and we have an arrangement with them around how we work in terms of the Care Act responsibility being retained by adult social care in the city. But Mental Health Act, etc., will stay within the London Borough of Southwark. So we do have these arrangements. We also have multi-agency responses to safeguarding. For example, if there's a rough sleeper who goes between Westminster and the City of London, we'll engage with Westminster, engage with services there, regardless of whose actual responsibility it might be, whether that's under the Care Act or the Mental Health Act. We will work together in terms of safeguarding across the local authority boundaries. And we'll also share information as much as we're allowed to do to protect people.
Go ahead, yeah.
If I may just come in and add to that, Steve, a couple other things that I think are worth noting around joint commissioning. So we do work across North East London, for example, in severe weather arrangements, cold weather particularly. We stand up a provision across North East London, which is a joint commissioning arrangement funded by the MHCLG, which is a very a good piece of work. And also, for example, other services that are funded by central government, where psychotherapy services that are delivered outreach, they're done across boroughs as well. So there's a number of examples where we are collaborating. And I would suggest that feeds into that final question and give some assurance about the fact that there is no position that exists where people are saying you should move over into the City of London. That wouldn't be happening, and likewise we wouldn't be saying that about people moving across into other local authorities.
Thank you. Ian, I've got a couple of questions for myself, and it's mostly around mental health and audit. I mean, the first thing is that it looks to me as though, whilst the numbers are small, and you may say therefore it's not significant, but the numbers of mental health capacity assessments seems to be reducing from 21-22 to the first 9 months of 24. Is the first question. Do we understand, why there is a kind of a bit of a decline in the numbers, or it might just be chance? I don't know. The second question is looking at the audit schedule, and I note that it says that an audit was undertaken by principal social worker for adults, and I just wonder whether we should have a more independent audit, somebody from outside the organisation. I think there's always value in that. You eliminate any organisational bias in findings. I think that would be quite helpful. And the final part of it is really coming back to mental health. Is do we feel that we've got a sufficiency of mental health support, either internally or externally? Because I know how under pressure mental health services feel, and whether that's a hindrance to some of the work that we might want to undertake. And if it is, have we got any thoughts about what we might be able to do to address that?
Okay, so in terms of the decline in numbers, there could be a number of reasons for that. We're aware that the decline in numbers from the work that we're doing is contrary to the increase in rough sleepers. So it's something we've been thinking about why that is. I think part of it is the transient nature of rough sleepers, and that we get referrals, then we can't locate the rough sleeper, and they may disappear into another local authority area. So that can be an option or a problem that we have to overcome. There are other reasons for the decline in numbers, such as, for example, people not wanting to engage with us, or a change potentially in the nature of rough sleepers, whether everyone has mental health issues or has adult social care issues. There's a lot of people who are rough sleeping who are there because of poverty issues rather than mental health issues or adult social care issues. So there could be a sort of slight change in the numbers there. But again, it's something that we don't know for exactly. It's something we're looking into and trying to support. But also, I think it's important to know that we do have a specialist rough sleeper, social worker and outreach worker. So we do a lot of work to try and engage with people, but admittedly the numbers are dropping slightly on that. In terms of audits, we do external audits as well. We have an external auditor coming in to do safeguarding. One's just been completed actually across safeguarding of adult social care. We have the principal social worker does sit outside the sort of hierarchy of adult social care and does do audits across adult social care, but we bring in at least one external auditor every year to sort of do work across us. We've had one on safeguarding recently. We're having another one on adult social care in general, sort of case audits. So we do bring in external to answer that question.
Okay, and when we get the outcomes of the audit, and forgive me if my memory is failing me, do we see the outcomes of those here, or are they built into reports to tell us how you're responding?
Yeah, we can bring audits here, absolutely.
Yeah. I mean, I don't want to overburden and ask for specific reports, but if it could be incorporated into something else that you're doing, but highlight it to us, I think that would be quite helpful. Amanda, I can see your hand up.
Yeah, thank you, Chair. Just in relation to the audit and linked to the sort of safeguarding aspect, just curious to understand whether that audit stretches into any of our homeless community that may well be under other areas of safeguarding or monitoring, such as Marek, for example, for high-risk DA cases that may well be sat within our homeless community, and sort of more broadly wider safeguarding risks, just with a different lens on it. Is that included in the audit?
That's not included in the specific adult social care audit. No, I think it's a good point because we're very aware of there's different multi-agency responses, and we have to be very clear on who's dealing with the particular issues because you don't want duplication and duplicated actions. But yeah, absolutely, the safeguarding audits from adult social care only. There'll be separate quality assurance mechanisms within community safety team, for example, looking at the Marek side.
Yeah, I just wonder whether there is a benefit if it's not captured more formally, whether we commission something from this group just in terms to have surety over that piece. I'm just, yeah, I don't think it's a blind spot at all, but just for extra surety and confidence.
Thank you. I think that really helpful comments, Mandy. Thanks. Okay, any other questions on?
Sorry, Helen, you had one more question, didn't
Sorry.
you, on the mental health side of things?
Oh, yeah.
Yeah, just to say that I think whether about the sufficiency, I think we don't have issues in terms of the response for referrals for Mental Health Act assessments in terms of our services that we commission from East London Foundation Trust. I think that the pressure tends to be at the other side in discharging from hospital, and that's why it's really important that we're engaging with rough sleepers to make sure that they go into safe, accommodated accommodation quickly with the right support, because I think that's where the pressure is. But the response that we find with our work and in terms of people and Mental Health Act assessments is quite responsive. I think there's sufficiency there.
Great, that's really helpful. I guess part of what was in at the back of my mind with regard to the question is the mental health street triage, because we, you know, it's every time that we're getting towards the end of the funding, we have a conversation about whether we're going to continue it. And I know it's very highly valued by in some quarters, but others it's sort of challenge it. But I haven't heard anything that would suggest that we should not continue to support that service. Yeah. Great. Okay, thank you all, Diane. Shall we move on then to item 6?
Thank you, Chairman. That's the housing assistance policy, and this is for information on pages 31 to 40 of your agenda pack.
Ian, is this you again?
Now, my colleague Jenny, who's the lead occupational therapist for adult social care, will be taking this and introducing this. Thank you.
Thanks, Jenny.
Thank you, Chair. So just by sort of way of background, Disabled Facility Grant, DFG, it's a grant provided by the local authority to provide financial assistance for the cost of essential adaptation work to make a property suitable for a disabled person to live in or be cared for in their own home. The DFG is open to eligible owner-occupiers, private tenants, landlords, social landlords like housing associations to apply for. The current sort of upper threshold for each application is £30,000, and the city has allocated 40,000, just over £40,000 per year for DFGs. The city had some underutilised funds for the DFG, and so the housing assistance policy has been introduced to the city to provide residents, staff, landlords, everyone really with the information about how they can access the funds and the process for it. While a DFG is means tested, each local authority can determine if they want to provide a certain amount prior to applying that means tests or facility. And in the city, an agreed sum of £12,000 has been allocated prior to applying for that means test. And this sum was identified because it was the sum that was sort of would cover most of the more common adaptations, for example, stair lifts or wet room shower facilities. So essentially, the housing assistance policy was introduced to provide flexibility to residents of the city and to provide more information about how the DFG can be utilised. There's currently a 12-month review recommendation on the policy. However, this can be brought forward if necessary. For example, if the current £12,000 discretionary amount, which is locally set, this can be reduced or removed depending on how, you know, we need to sort of manage the budget and the finances. However, I want to stress it won't leave those who are financially in need without having the adaptation, because residents who are already on means tested benefits would automatically qualify for the grant anyway to provide all the recommended works. So this is how by way of introduction, this is how the housing assistance policy came into being devised. But just also to stress, if there are residents who want to self-fund, there is also access to the project management sort of side of things and the Home Improvement Agency, and obviously in adult social care, we will provide the assessment, the recommendations, any designs, any sort of support around organisations, companies with quotes and things like that. So yeah, open for any questions.
Thank you. Kerry.
Thank you. The paper's really helpful, by the way, so thank you. And actually it came up in housing yesterday, so doubly helpful. Can I just ask, so there's a resident that I'm aware of who has breathing related problems and has been trying to get a key safe put on, and then was recommended that they should get the emergency button so that, you know, if they're anywhere in their property and then hurt themselves. Does funding for that fall under this, or would it be a separate funding?
So that's separate. That is provided through adult social care.
Ah, right.
So, you know, that's something we can definitely assist with.
Okay.
With regards to the housing assistance policy and DFGs, we have also got a series of events where we are going to inform the residents, and they're going to be across the borough. So we've got an event at Guildhall, at Golden Lane, and at Portsoken. So we can, share more information about.
Yeah, do you mind, whenever they're happening, can you let us know so that we can share with residents as well on the WhatsApp groups and stuff like that, if that's all right? So yes, thank you.
Anne.
Good morning. Thanks for the report. Can you give us some information about discharge from hospital? So I understand that a patient will not be discharged into a home that doesn't have the right adaptations, and that you will rely on a report from the hospital staff. Is that correct?
I mean, with discharges, we go on a case by case basis. Obviously, we don't sort of have a blanket, this is what we require, this is what we need. But we do require obviously some information about what their needs are, and why the current property is not suitable, because more often than not, people can be discharged to a sort of micro environment, and then we can then sort of process adaptations sort of as quickly as we need to support them to stay in their homes for longer.
We'll wait until the patient is discharged before you'll get involved.
Not necessarily. We do have obviously we have a we're in constant communication with anybody who's in hospital, with the discharge hub, with the ward, with the therapists, and obviously the aim is that they will improve and continue to improve. So it's not that we wait. It depends on if there's any sort of ability for the individual to improve further, because we don't want to overprescribe either. If that makes sense.
Can I just follow this one up? Because my understanding is as a core part of the discharge process is where it's likely that people will need aids and adaptations, that there's an OT home assessment in advance of discharge. Does that still happen? And B, to follow up on Anne's question, if they are home assessed and it's clear that aids and adaptations are needed, that they are put in place before the person actually permanently leaves hospital. Is that correct?
Yeah. So equipment or aids will always be provided before they leave hospital, so it's already at home. Certain adaptations are done, sort of more the minor things, like you sort of mentioned key safe, or like telecare, or sort of grab rails, things like that we can do. And we can do access visits. We'll support, obviously all the hospitals are out of borough, so the inpatient therapists won't always do a home visit, which used to happen more so, but we support with doing access visits where required, either with our sort of therapy colleagues in the community, or we will do from adult social care.
I suppose what I'm getting at is bed blocking, people stuck in hospital because they're waiting for an assessment. So do you know what the scale of that? Is it an issue?
I'm not aware of numbers, but I'm not aware of any that, yeah, Ian, because of adaptations.
No. I think when we do have delays in the City of London, they're almost exclusively down to family choice, or so when people don't want to go into a particular residential home or don't want to go home or whatever. So it tends to be more around that rather than a lack of provision.
I just want to follow up on a point that Kerry made, because we did yesterday's housing sub have a paper on an AIDS and adaptation policy, which I think we felt needed a bit more work on it, but in essence we're comfortable with its content. But it is slightly different to this. It just seems to me that, you know, we should have a single AIDS and adaptations policy, and I guess it should be comprehensive, that incorporates the things that you might have in here and the things that we were considering in housing sub yesterday. I don't think it's helpful for us or for the public to have slightly different papers saying slightly different things, although there's clearly a lot of commonality. And given that one of the things that we are constantly pushing for in the city is to get away from silo thinking, we can't have silo thinking in DCCS. You know, we should be an example saying we're pulling it together. So if you could just have a look at that in the future, and particularly check with housing colleagues, because if that paper's coming back after some of our questions were being clarified, it would be helpful if that comeback incorporated anything from here that needed to be in it. So we're looking at a single AIDS adaptations policy. That would be great. Thanks. Okay. No more questions? Then let's move on to item 7, Town Clerk.
Thank you, Chairman. Item 7 is the Adult Social Care Safeguarding Performance Report 24-25. This is for information on pages 41 to 44.
Hi. Sorry.
Ellie, it's you, is it?
Yeah. So this is the usual performance report, the quarterly one that we bring to the Safeguarding Subcommittee. The actual documents contained in the private section, the actual data. But to say for 24-25, sorry, this concentrates just on safeguarding and deprivation of liberty safeguards. The number of concerns within COL that were in the COL boundaries was 49, and 21 of those became inquiries. That's a very similar rate in terms of concerns from the previous year, and with the inquiries it's slightly down on the previous year, but yeah, that's the sort of headlines, and I'm happy to take more detailed questions in the private section.
Thank you. So yeah, as Ellie says, the detail is in non-public. So if we've got any questions on the headline, we can take them now. Otherwise, we'll defer anything of detail to later in the meeting. So anything for now? No. Okay. Thank you, Ellie. We'll move on to item 8.
Thank you, Chairman. Item 8 is Families in the City update. This is for information on pages 45 to 56.
And hello, I'll be introducing that paper. I'm Rachel Talmage, and for the purposes of this report, I am the programme lead for Families in the City, co-authored by my colleague Hannah, who is the programme manager. And this piece of work began in March, and phase 1 is due to be completed in September, and it brings together 3 work streams to make sure that there's not overlap or omission. And it brings together the 3 work streams, which are: 1, the new social care reforms, which is the biggest children's social care reforms in quite some time, which is the Family First programme. It brings together work for Start for Life for children and families between 0 and 5, and it brings together the drive towards a family hub, which we have finishing phase 1 with. The whole essence of what we've been doing is trying to make sure that any work has the greatest reach in terms of equity. We want to make sure that every child in the city is able to access our offer. So we've thought about location, we've thought about delivery models. We want to make sure that every child, regardless of economic status, race, disability, and across the protected characteristics and otherwise, are included. And that's been the driving force of all of our work from the beginning and throughout, alongside just a desire to not duplicate asking families for their views. We know that families often feel a bit overwhelmed by view seeking. So what we did was we started our work with taking all the views from children and families that we got from different locations as a starter. So we knew what families had said already, and we've set up a family design lab to bring families alongside. So we listen and learn as we go and test out ideas as we go. And that is, the comms is up and running. So what you'll see so far is on our family information site is the family design lab. Our way of engagement is there. We've got people signed up to that, which is great, and we'll try and cast the net wider. We've also been doing engagement with staff alongside. It's working at pace, comms is out, and you'll see already, hopefully, in the city that we've got a physical location on a Friday at the Oldgate Centre attached to St Botolph's, which is a beautiful venue, purposely designed, and the Shoreditch Trust are there in person. That's funded in part by the City of London through the Neighbourhood Levy, and we'll be offering all sorts of different support, including they work very much around food and lunch times, and a free food offer or a contribute what you can offer physically there. We're mindful of offering at the beginning in phase 1, you'll see at the beginning of September a virtual hub which says about all the different services across the city at different locations, so it will be accessible no matter where you live in the city, no matter where you go to school, or no matter where your family works. So hopefully something will be accessible throughout the week. What we'll make sure is that every provider of services knows about every other provider of services. So not only will the information be clear on our Family Information Service website, but each provider, for example, if you're going to the library for a nursery rhyme session, or you're going to a breastfeeding clinic elsewhere, or you're going to a young carers activity session, that those people who are running those sessions or facilitating will know about everything else that's happening in the week. So it will be a tight offer, and this is phase 1 of our work around the family hub. Around staffing, with the children's social care reforms, that's coming along. We've learnt from people who've implemented them already, and we've got a connection with other local authorities across London, with the DfE, with the London Borough of Redbridge. So we're learning and listening. Obviously, we have our own way of working in the city, which is valued by the community, but also valued by our inspectorate. And we want to make sure that we're growing in our offer. And at the heart, as I said, of everything we're doing across this programme is equity and accessibility, and not making change just because we're just because of external factors, but making sure that actually delivery and impact is central. I'm happy to take any questions with my colleague Hannah, if that's okay. I'm so sorry, I can't see you in the committee room.
Don't worry. Don't worry, Rachel. Just no, that's fine. Thank you. We'll come to questions. Kerry.
Thank you. Thank you for the paper as well. It's really helpful. So I'm just wondering, have you managed to get 15 people to join the design lab?
Hi, we have 12 parent carers signed up at the moment, which is a really great start. Yep, so we're going to just, we've got our welcome session later on today, and then, yeah, we're going to review our comms and reach again and try and do another push.
Yeah, I'm just wondering, so I've spoken to Kirsty about this, about something separate, just to do with early years stuff, but I'm just wondering if there's a way that you can contact families directly, whether it like sending something through the door to let them know more about it, because it's not, I don't think it's been as widely shared as it could have been, which is a shame, because obviously it's a great initiative, and I think it's really important to try and get as many families as possible involved.
So just to follow on from that, before you answer, have we had a specific drive in Portsoken as well, given the issues that we've had around Aldgate School and the understanding or not of family hubs and Start for Life? It would seem to me to be a great opportunity to get people from that area more directly involved in this if we can, because it'll help build a level of understanding that we haven't quite reached. Rachel, do you want to, Hannah, one of you want to respond?
Yeah, I can do. So we've also sent it out to everybody who we work with in children's social care and early help. What has been useful is the Shoreditch Trust has been in Portsoken physically letting people know about their services, but I think that's a good idea to also do that alongside them. They're very keen. They've offered us a space to be alongside them in the delivery at the Old Gate, but they've been physically handing out flyers, etc., so to promote the offer of the hub. But if we do that alongside them with the family engagement, then that will be good as well. Thank you.
Sorry, Steve.
Yeah, two things. Well, firstly, Rachel, I think your comment about making sure that we continue to provide the service as we see fit, rather than us being told by a national government the way to provide the service, I think is a good comment. And I would certainly support that, particularly in our area where we're dealing with such small numbers. The other issue is the Aldgate School. Now, we made a commitment at CCS to work with them over the next 2 years, and they don't seem to be included in the planning work here. And I wonder whether we've reached out to them to invite them to be more engaged, and if not, whether we can, or if we have, what their response was.
Steve, looks like you want to come in.
So apologies about my voice today. So with the Aldgate School, there is the issue of the Portal Trust and the lease around accessing the actual school. I think there's a possible safeguarding concern around if parents aren't parents of the school children as well. So we haven't completely. So at the moment, there are a couple of stays and plays that are being run at the Aldgate School, but most of the provision is being run outside of the Aldgate School. We have a timetable. So at the moment, what we're trying to do is just for the continuity of delivery from September is just try and continue what we can from September in other locations. But absolutely, we haven't given up in terms of trying to work with the Aldgate School. We will always work with the Aldgate School to try and deliver services. But I think right now it's not an option to run services from there.
Steve.
I'm not really talking about running services from there at all. I'm talking about us trying to ensure that they are a partner, like other organisations, like the Shoreditch Trust and other organisations, in how we create our vision for how we're going to provide services for children in the city in the future. That's what I'm really talking about.
Yeah, I just want to follow up that, because everybody here will know that we've given a very firm commitment to Aldgate School and to the families who have an interest in Aldgate School, that we will work with them specifically around 0 to 2s, but more generally around ensuring that families who live in that area have got access to a whole range of services, notwithstanding the development work that's underway here. And so I think we have to honour that commitment in its broadest sense. And I think that in planning for the future and where services might be accessed and how easy it is for people across the city to access services, that we have given proper consideration, which is why I think it's so important to get families who are connected in Portsoken and Aldgate to be part of the design hub. I mean, that's absolutely essential that we get people. If people say no, well, fine, but we can say that we've taken all efforts, made all attempts to involve them. Chris, I think you want to come in.
Yeah, thank you. If I may just draw members' attention to the governance structure that's in the report on page 48, to offer some reassurance about the role of the school within that. So you'll see there that you've got the Families in the City board, which is in blue in the middle, which is the board that Rachel chairs in her role, but reports into various other groups. Aldgate is part of that structure, so it sits in there. So it's a member of the Early Help subgroup, it's a member of the SEND programme board. And so they are directly involved in decision making in relation to the direction of travel that this programme will be going in. Hopefully that offers some reassurance about their voice being built into the governance of it.
Yeah, it offers some. I think I kind of need a bit of the proof is in the pudding. So we need to play that out. If I could just ask one more question as well. On page 55, there's a summary action plan, which has got from the 21st of May down to June onwards, with my understanding of a deadline is that those actions should all have been completed by now, and it doesn't show that. So I wonder if you could just comment on that. Rachel, I see you've got your hand up. It might be for a slightly different one, but if you could respond to that. And now Hannah's hand's up as well. So whichever of you is the most appropriate, respond to the action plan and respond to the broader points we've been making.
Yeah, I'll do the Portsoken bit and Hannah can do the action plan. I think that's probably where our passions lie. The whole point of this project is the reach. And one of the things that we are doing in the Family Hub lead is facilitating activities in the summer holiday and providing support there alongside our virtual school head as a offer, and promoting the design lab as part of that work. So it's a free service designed for anybody accessing my service and children with disabilities and those in need over the summer holiday, and we'll be physically there talking to families there about the design lab. And the whole point for us is to do the reach to make sure those who have been left behind or are at risk of being left behind are included. And I would say that the beginning of every one of our partnership board meetings is around equity of access and the voice of children and families. And we're definitely mindful in the way that we've set up our family design lab to think about who's not in the room as well. So if we've got gaps or you know, who is not being heard, and making sure we're going away there. So it's in our very structure, and it's the very heart of this piece of work that we're doing. Absolutely open to more suggestions of that, but I would say that there's a 3-week programme in the Oldgate School where we will be talking about the family design hub and the family hub and the design work there, if that helps. Yeah, on the ground. Yeah.
Hannah.
Yeah, thank you. And just to offer assurance, yes, all of those actions in the action plan have been completed. Sorry, it's just the deadline of the papers. It got submitted before they were completed. So yeah, just to say it is done. The lab has been launched. This action plan is live. So I have an updated document, and we have a welcome session this evening, after which we hope to plan a more sort of thorough programme of activities. And as Rachel said, we can keep it under review. So if there is a group that we're not feeling we're reaching through the membership of the lab, we can run some specific sessions under the banner of the design lab, but out in the community to try and reach those. Thank you.
Okay, fine. I've just got one final question, which is, I mean, there's clearly a lot of work and activity underway in all of this territory. I guess the obvious question is, when might we see a firm proposal about what's going to be provided, where it's going to be provided, and when it might be provided? So when would we expect to see that?
If it's okay, Hannah, I'll take it. So the first week in September, you will have a full suite of everything that's on offer on the website. But as I said, it will also be accessible in person. There are many in-person locations across the city, so you'll see that then. And then, but that's the first phase from which we're starting, given this programme started in March. But you'll see the full suite there.
I'm not sure that many of us are going to be searching the website. So is there a report that's going to come back here setting it all out for us at possibly the next meeting, or does it go to CCS given the interest that's been?
Yeah.
I don't know.
Can I take this, Rachel? Yeah, absolutely. So this report went to CCS for information last week, and there's obviously the reporting committee. So all progress on the programme will go into CCS. You know, not least because of the issue, you know, the conversations that have happened around Aldgate, but also the, you know, the strategic significance of this programme. So we will get updates. I think what perhaps if members are happy with this, we can also, because of timelines and timescales, if there is immediate notices of, for example, from the 1st of September, we can circulate to members of the CCS that this has been launched on that date, for example, and not wait till the next committee, if that helps for information.
Yeah, Anne?
Sorry, what is the website address?
I can put that in the chat if that's helpful. That's got the news at the moment, but then it will be on there. We'll also hopefully have little postcards as well with details on that can be shared, which will have the the information there, but do just for note, there's Fridays at the moment at the Aldgate Centre in person for any resident of any age, actually, including lunch, which is welcome. Oh, thank you, Hannah, for popping that in. That's great.
Yeah, thanks, Rachel. Can I
And
just?
we'll do.
the
We've got
next-
a comms plan with Hannah, who's very organised. So there should be comms before that as well.
Kirsty, last comment, and then we'll.
So just to say that we do have a current timetable of a delivery this term. We always do before the term comes along, we have a timetable we put together that covers a number of sessions, you know, sort of therapy times as well for families. So it's 0 to 5 and we'll be moving forward in September. So there is a current timetable, and those sessions are being delivered across the city at the moment, including the Aldgate School. So we will ensure that that is in place by September as well, and it'll encapsulate what Rachel said about the wider scope around sort of 0 to 25. Yeah.
Okay, thanks very much. So I think what I'm asking for is that there is a CCS in September. I think that a report updating us on the, you know, the what, where and when, albeit it might have been launched on the website before we get to CCS, but nevertheless, I think it should be CCS paper. And I'd suggest that it's not just tucked away in the information reports, because we don't discuss information unless people have got specific questions in advance, but that we have it as a discussion item. And again, it's about managing perception and profile, because there's so much interest in this. I think it has to be a paper for discussion. Not clearly, if it's already launched, it's not about decision unless there's something that we fundamentally want to see presented differently. But if we could, in the public part of the meeting, obviously. Yeah, great. Thanks. Okay, then can we move on to item 9?
Thank you, Chairman. Item 9 is Children and Family Service Performance Month 12, 24, 25, specifically March 2025. This is for information on pages 57 to 64, and there is a non-public appendix to this report.
Thanks. Ellie.
Yes, so this again is our usual report that we bring. This one covers the whole of 24-25, and we'll discuss any sort of detail in the non-public section. But just to say, in the document, the head of service comments a really useful summary there that sort of contacts, referrals and assessments have slightly decreased over the year, but are still commensurate with our population. And to note that there's been a better sort of mix of contacts from partners due to some awareness raising work we did. Early help is very consistent. The children in need are slightly reduced over the year also, and children in care and care leaver population have both reduced. All of these things have a sort of knock-on effect on each other. But some of this is due to sort of prevention and some of the early help work that happens. And just to say on the care leaver offer, some of that is because young people have what's called aged out when they've reached the age that they no longer get support. But we have made a specific offer about doing ongoing light touch support to care leavers if that is needed for however long they need it. So that's a brief summary, and as I say, we can discuss any detail in the non-public section.
Okay, I just had one question, and if you think it's better in non-public, please say, but just that there's a downward trend pretty much on all of the numbers. Do we understand why that is, or do we need to move that to non-public?
I think we could cover that here, Rachel.
Yeah.
Yeah, am I code to jump in? So
yeah.
So one of the areas that looks less is the child in need work. What we've done is most of those children are actually now being supported by short breaks, which is our long-term children with disability offer. So it slightly gets hidden, that kind of figure. So that work continues. And what we do with that short breaks is in line with the Council for Disabled Children's recommendations about not always having to reassess and going through statutory, not go through the SIN process, but having the light touch. So families who access short breaks actually have quite a lot of support. They can ring in, speak to our early help manager who is actually a qualified specialist disability therapist as well, which is we're very lucky, and they can have support that way. So light touch throughout without the family having a child in need process around it, but they've got the short breaks process around it, which meshes well with the EHCP. So in a way, the SIN numbers look smaller, and they are, but it's sort of balanced with what we've developed much stronger as our long-term children with disability work with short breaks. In terms of the care leavers, yes, those numbers are going down. One, because the national transfer scheme is working. There's a government incentive nationally for receiving local authorities that they get. I think it's £10,000 if the young person is moved within 2-week period. That's really worked nationally. So incoming children in care are moving quicker if they are unaccompanied asylum seeking children. And yes, our child care leaver population is going down, which is something we're mindful about, and looking at where our busiest area of work, which is our early help and short break service, which is the area of growth. So yeah, if that helps, might be too much detail.
Okay, thank you very much. Any other questions in public? No, okay, then let's move on, please, Town Clerk.
Thank you. We now move on to item 10, which is the Children's Social Care and Family Help Service Development Plan 25-26. This is for information on pages 65 to 72.
Rachel,
that's
this is
me.
you again. Yeah.
Yes, I'm sorry. So I'm in the role of head of Children's Social Care and Family Help in this piece. For members who are, we have a service development plan that's worked on throughout the year, and it's every year it looks at national research, it looks at the views and wishes of children and families, it looks at compliments and complaints, it takes views of family social workers, it takes learning from independent and internal audit, including inspection. This year is probably smaller than you may have seen in previous years because of the work in the families in the city and the actions that we're doing around that. That is the bulk of the non-direct delivery work. You'll see we had obviously our very successful Ofsted, and there were 2 recommendations within that I have that even though we have met, we keep on the development plan to make sure we don't lose grip on that, to make sure that practice is established and continued. You'll see some new things that you may not be used to seeing around anti-racist practice in terms of the racism experienced by staff from service users. And we want to make sure that that is named and labelled, and that we offer staff support so that staff are cared for well, so that they can, one, it's a duty of care to staff, but also so that they can continue working with the community. Sometimes it can be hard. People who are struggling don't behave well, and that's understood from a trauma-informed point of view, but we have to look after staff as well. So I'm aware that comes across strongly, and our work now is particularly around housing, the responsibility of tenancy and the reality of tenancies for care leavers particularly. And as Ellie said, we do, after we stop formally working with care leavers at age 25, we have a post-25 offer that's lifelong, which is light touch. If care leavers need help, as if you were, like, the idea with care leaving and looked after children is, would this be good enough for my own child? And in your own natural families, if you like, you would be caring for your child throughout life, and you don't cease being their parent. So in that way, our post-25 care leaver offer is very much a signposting or a you're very welcome, we'd love to see you kind of offer, so that there's a sort of a very early help, if you like, towards adult support. And that's what we're doing around tenancy support, but there's plenty in there, and there's plenty of work to keep on doing to make sure that our children and young people are thriving and continue to thrive, including our resident children, which again will be much of the work will be around the family hub, but it is also strengthening our work for children with disabilities. So I'm happy to take any questions.
Okay. Any questions?
I can't see the room again, so I can't see.
No, don't worry, we'll direct them to you. Any questions, anyone? No? No? Okay, I think we're moving on then. Thank you very much, Rachel.
Thank you, Chairman. Item 11 is the Education and Early Years Service Safeguarding Update. This is for information on pages 73 to 82.
Kirsty.
Thank you, Chair. So this is a regular update of the work of the Education and Early Years Service to support the safety and welfare of children, both city residents educated in and outside of the city and non-city children attending schools within the city. So this report highlights the recent progress in 5 key areas. So tracking and identifying children on SEND support, implementing the new statutory guidance on school attendance, and monitoring children and young people at risk of missing education, supporting elective home educated children, and managing performance licenses and work permits. So any questions?
Steve?
Yeah, well, just to show I've sort of read these papers, you're saying that there's 331 children of school age living in the city. In the private fostering report, it says there's 713 children. Now, I realise that the 331 is a subsection or subset of the 713, but is that really true, that there are 400 children under school age living in the city?
Okay.
I'm sure the chair will let me come.
Sure. So the 330 children isn't part of the wider number of the private fostering number. So essentially what we started up a few years ago was trying to identify the number of children, City of London children attending schools outside of the city. So this is a manual piece of work that we do on an annual basis. We write to the schools, we use school admissions information to identify who those children, young people are. A few years ago, this figure was corroborated by the Department for Education in terms of the numbers that they were aware of in statutory schools. So it's 5 to 16. So this work I think it was 2015 it started, and it seems to be about around that figure every year that we've done this. From September, the Department for Education is in a sense allowing us to access figures for children who attend school outside of the city. So at the moment we have to do this manually, but from September we will have access to that information that other local authorities have within their own school censuses. So we should be able to get more of an accurate figure. But I mean, that's something I can certainly take back and look into. But those two data sets are separate.
Yeah, sure.
So and also, do we know how many children who go to school, who live in the city, go to independent schools as opposed to state schools?
Yes, about 100, between 80 to 100. So that figure includes that.
Okay, that'd be quite useful to put that in further reports, I think, so we know.
Yeah.
Okay, that's absolutely fine.
I think that, I mean, and I can't say that I'm confused, but I don't know how the numbers all add up, because we also had numbers when we were looking at Aldgate school papers of the numbers of 0 to 2s and of the total number. So I think we probably need a very straightforward data set here or in CCS, I don't know quite where, which says total number of children that we've got, total number who are preschool, and then, you know, the numbers that are in primary, and then the numbers in secondary, and then secondary, and then to break that down to those that are independent and those that are in COLA and those that might be somewhere else. Sorry, and home educated, yeah. So because I'm not at all clear that I have a comprehensive picture now of which children are where. Did you want to come in?
Yeah, I think the slight risk there is we lose children somewhere. You know, if parents don't engage with services and then decide to electively home educate, and we don't know who they are.
Yeah, absolutely. So so there is another piece of work that's being done through the London councils, because at the moment the CME regulations, it's really difficult. The CME regulations 2016 only allow for schools in an area to let the home local authority know. Obviously, when we're alerted from a school in the city that a child is being taken off school roll to be EHE, or they're moving out to the area, we will alert those local authorities, but there is no statutory responsibility for that. Yeah, it's about to change. So once we get that information, I think we'll be even more alerted. Yeah.
Giving you a hard time here, especially
That's
with your
okay.
voice.
Don't worry, Steve.
But also, I think this report also says there's 44 children who are SEND.
SEND support and SEND
Um,
support, yeah.
I think that's, if we're right about 331 children school, that's a relatively low percentage, I think, compared with national figures, which have boomed up, I know. So again, I suppose the two things are, you know, how sure are we that that is the right number? And secondly, you know, what the thing about SEN is, of course, is that there's all sorts of different issues that children have who are described as SEN. So a little bit more sort of understanding about what we're trying to deal with here, I think would be good in the next report.
So those children that we've captured, so we've written to those schools, we've asked for information on those children, including whether or not they've been to alternative provision. And so those SEND support children have come directly from the schools. They've been, obviously, information's been shared securely, but they've given us that information. So we're pretty confident, but those are the children on the SEND register. They don't include children with education, health and care plans. But I do appreciate that we are doing some work at the moment to try and capture how well or our figures against the national average as well, because we're very mindful, for example, in the last 6 years, that our numbers of education, health and care plans has doubled, which still is a very small number compared to other local authorities, but 100% in 6 years is quite large. So then, therefore, the number of children on SEND support is potentially has increased as well.
Can I just add something?
Yeah, please do.
I was just going to say, I think sort of going back to the original question in your comment, Helen, we can definitely provide information from the census that gives us all the different age ranges. You often see it presented in different ways in different documents, depending on whether we're looking at primary age up to 16, up to 25 with SEND. So really happy to present to the committee or send around virtually a sort of proper breakdown of the different ages and how that makes up the total. So we'll take that away to do.
I think that would be really helpful, Ellie. Thank you. And I suppose I'm just looking through the paper again and looking back to the title of the paper, you know, sort of an update. And I guess in terms of policy stuff, it gives us an update. But I don't think I feel any clearer about the numbers of children in our system and the adequacy or not of the provision that is on offer to them. And therefore, I can't see what service gaps there might be that we should be considering from a safeguarding perspective. So I think it's probably a slightly different kind of report that we are looking for. And it's something that is, you know, much more numeric and outcome focused as opposed to input focused. Thanks. Any other questions? Kerry?
Thank you. Can I just ask, in terms of children who don't or avoid school, who are very good at not going, what work are we doing to try and help parents or them like actually get them into school, get them back into school?
So there is a lot of work that we do alongside early help and social care and the virtual school as well. We meet very regularly and we have something called the attendance improvement group. So where a child's attendance drops below 90%, we will discuss that child, what support that child needs in order, and what support the family needs as well. So we are extremely proactive. We have an education welfare manager who works with the schools in the City of London. So that is children who are city and non-city, because we have that safeguarding remit for all children. So that education welfare manager goes out to schools every term, every half term, including the Aldgate School, and works with those staff on addressing those needs. Hence why we haven't actually yet issued a penalty notice, because we're very mindful of a lot of those families. It's a very punitive way of doing it. We will not do it unless we absolutely have to. But there's a huge amount of wraparound support that those children and families get. I guess the difficulty for us is where you have 300 or so children attending 60 different schools. You know, that's the difficulty. However, we do, as part of that census that we do every year, we write to those schools. We give them the information on early help services, and we invite them to contact us if there is a concern about a child or young person. So we are trying to build up those relationships with schools, but it is difficult we might have 1 or 2 children in one school. It's a bit like a scatter diagram throughout. So we are doing our very best to do that. And hopefully with the new way of working that the government's putting into place around sharing that information, we will get a more accurate figure of which children are where, and therefore we will then target those children, those families in those schools to make sure that they're getting all the support that they need.
Yeah, do you get involved in managed moves, secondary age, particularly around year 9? Are the schools good at contacting you if they're involved in negotiations?
It depends. It depends if the family is known to early help, our service has an education, health and care plan, then absolutely. If not, then we wouldn't necessarily know that a managed move was taking place. And I think that's exactly why it's very important for us to have this new information going forward around that sharing of information between London boroughs. I think we have about 20 local authorities where our children attend school. So we where we can, we absolutely get involved and offer that support. And we have orchestrated a number of managed moves to support and also just advise parents. I mean, we have, for example, there has been an increase in the number of families over the last 5 years who want to electively home educate because they feel that they're not getting the right support in the schools. So we support those families to really understand what EHE means. And we work with those schools to try and provide as much support as we can to those families. And we actually have stopped a number of families from electively home educating as well, simply because we've been that bridge between the family and the school. So we do absolutely where we can. We're very much involved. We got a notification last week about a child, and we already had a visit. Already visited that family. We'll work with the school with that child who has health needs. So yeah, we're very, very proactive.
Rachel, I can see your hand up, but Debbie, I think I also saw your hand up go up and down again. So I don't know if you wanted to come in.
Just to say that I work very closely with Kirsty and her team and with colleagues in children's social care as well to monitor the attendance of children who aren't known to us. And it's a very effective way of getting involved as quickly as we possibly can. But as Kirsty says, if the children and the families are not known to us, we rely on the schools to get in contact with us if they want to do a managed move, and some do and some don't, and quite a lot of the work that the virtual school is doing with schools that our children attend is to provide training so that school staff know that we're there and they can contact us and we will support them as best we can.
Thanks very much, Debbie. Rachel.
Just wanted to give some practical examples of the things we do to support children to remain in school. So in children's social care and early help, just a couple of examples. One might be the social worker going in the mornings to help somebody get up, helping with bedtimes, doing some practical parenting, providing some family support to while somebody might be struggling to go in, to think about meaningful engagement, etc. So really practical early help and social workers in the home before school, to help with the school run, to help the parents support, and just very practical parenting help where that's a parenting issue. Obviously there's extra familial and all sorts of other things, but just to give a flavour.
Thanks, Rachel. Thank you. Okay, I'm going to move us on then to item 12. Town Clerk, please.
Thank you, Chairman. Item 12 is the City of London Quality Assurance of Care Providers Annual Report 24/25. This is for information on pages 83 to 94.
Laura, I think you could give us headlines.
Absolutely. I'm Laura Dimitriades, Head of Safeguarding and Quality Assurance. So back in April 2024, DLT agreed that we start a programme of visits to our independent care providers by our senior leadership team. So over the year last year, 6 visits were completed, and that represented 22 children and young people who were being provided care by those care providers, which was 39% of our children in care and care leavers being supported. We made sure that we had a focus on our children with special educational needs and disabilities, recognising that they're particularly vulnerable in this group and often placed at quite a distance from the city given their needs and the care being provided. So visits are generally seen positive support and services being provided, with workers knowing and understanding the needs of our children very well. One visit found less satisfactory services being offered, and while that agency absolutely took on board our feedback, we did make an internal decision to not use that provider going forward, and we moved that young person in a planned way from that provider. So visits have resulted in a range of recommendations, some for individual young people and some more service-wide developments. These are tracked through our monthly quality assurance recommendation tracking meetings and through our commissioning review meetings. So having the commissioning review meetings combined with our quality assurance visit, I think that gives us a robust monitoring process, ensuring that the quality of services for our children in care and care leavers are strong, and that senior leaders have good oversight and understanding of the day-to-day experience of our children and young people. So happy to take any questions.
Thank you very much. Questions, anybody?
What kind of distance are these young people living out of London?
So the majority of our children in care and care leavers live in Greater London. Those that require specialist residential services can be living we're looking at Norfolk, though, you know, a couple of hours travel from Greater London. But it is very much based on their specific and unique needs and the best service to provide the services that will meet those needs.
And when they come back into the community, have you got plans so that they're integrated back into the City of London?
Absolutely. So those that will meet the transition for kind of adult services, we start at 14, which is particularly early in terms of looking at the transition planning for our children with disabilities and special educational needs. It might be that they do return to the City of London if we've got the right resources to meet their needs as a young adult, but they might. It's about where the right resources would be for that young person longer term as an adult, depending on their transition needs and long-term care needs. But we'll be working with any family members and wider network to identify that along with our adult social care partners.
So if the young person's got complex needs, what are their chances of coming back into the City of London?
I would suggest, in terms of, we know there isn't very much provision based in the City of London, basically. So I would say that was slim. But obviously we'd be working with them depending on their wishes and views, as I said, with their family in terms of what their wishes and views are, and trying to seek the best support placement. I couldn't honestly say where that might be for that individual.
Just to check, I mean, as far as possible, whatever the long-term placement is, that is agreed with the the young person and with their families.
Yeah.
And you will try to find as best a match as possible for their wishes and their needs.
Yeah, absolutely.
Okay. Any other questions? Kerry? Oh. No.
Thank you. Thank you to you and the team, by the way, because you obviously do really good work on this. So thank you. Can I just ask about, sorry, on page 90 at the bottom paragraph, there's a point made about a fence. There was an issue that needs to be addressed at one of the properties. Has that now been resolved?
That's Debbie's visit. I'm not actually sure. We had at our last, at our last commissioning review, they were in the process of resolving that issue. It is a large country estate where the school is based, so I can follow up and make sure that that's been resolved.
Thanks. Good. Then, well, thank you very much. As Kerry says, there's obviously a lot of work going on in here, Laura. Thanks a lot. Okay, so item 13, Town Clerk.
Thank you, Chairman. Item 13 is the City of London Virtual School Report. This is for information on pages 95 to 116.
Debbie.
Hey, thank you, Chair. This is a virtual school update and school development plan, and it includes all of the work and activities that have been taking place throughout this academic year. We're constantly focused on providing advice and support to get our children and young people into education and keeping them there so that they can make the very best progress that they can and then move on to their chosen career paths successfully. For some extra information, the City of London Virtual School is hosting the Shining Stars ceremony at the Guildhall on the 14th of July, where all the virtual school head teachers from across London will all come together to celebrate 2 young people from each local authority for their outstanding achievements in education this year. And we will have 2 young people who have been chosen by the City of London, and they've achieved a raft of qualifications towards their chosen careers of music technology and engineering, which is great. On October the 6th, we'll celebrate the education achievements of all our children, city children and young people in the Livery Hall, and any member who would like to attend would be most welcome to come along and celebrate with us. And in the autumn, this committee will receive the school's annual report with attendance and attainment data, and it will also be able to read about the destinations of our young people, and there will also be an academic plan for 2025-2026. I'm happy to take any questions.
Right, members, Kerry.
Thank you, and thank you for the report. Again, very you've obviously put a lot of work into it, so thank you. Can I just ask on page 96.4, I'm just a bit, again, it might be me being a bit thick, but some of the numbers I don't quite understand, because it mentions there's 20 children who have a social worker, I think, but then there's another point later on that says the number currently on roll in all cohorts is 87, and then it says approximately 90 children are being supported.
Yes, our numbers fluctuate constantly because there's children who come into the care of the local authority of this corporation, and then they will go back to their families, or they may well be unaccompanied asylum seeking children who will come to us temporarily, sometimes for 4 weeks, sometimes for 3 months, and then they will move on. And then we also have children who are on child in need plans or child protection plans, and they may come to us and then they become children who have had a social worker in the past 6 years. So our numbers tend to fluctuate depending on whether they come into the school or they stay with us in the school, or whether they then move on. And then we also have young people up to 25 who age out, because at 25 they have left being a care leaver, although they're always very welcome to come back to us, and some do come back for support and advice as well. So I think the figures are a little, that I do update a dashboard. I have a special dashboard every month because my figures are constantly changing, but generally when I look back over the years, it's about 90 children that come and go.
Yeah, that makes sense, thank you. Can I also just ask, does it, when people become, the young people become of an age and then can obviously move, if they move into another City of London property that's not one of the estates outside of the city, do they still get the same support from your team?
Yes, they do. They get the same support from my team. So right up until they're 25, I still support them. And I work very closely with local authorities right across London, because it's really good that we work together, because you know exactly what's available within your local authority. So if one of my young people wants to do a specific course, I can contact the virtual school, say across in Croydon, and say, what sort of courses have you got going on in Croydon College? And they can give me the details of that. So it's really good to work together.
Yeah, that's brilliant. Thank you.
Okay, again, Debbie, thank you, because I think that we're very fortunate to have the virtual school here. I think you do some absolutely fantastic work. It's great. I was going to say to members, if you haven't been to the celebration event that's coming up in October, please do go. It's a fantastic opportunity to talk to some of the young people, and seeing some of the pride from some of the young people who, you know, kind of come to UK and end up in London without able to speak any English at all, and then to see them progress through the school system, and young people who are finishing degree courses in engineering and all sorts of amazing subjects. And it really is a fantastic event, so I would encourage everybody to come along. I don't think we've got any other questions, so thank you very much indeed, Debbie, for the report.
Thank you.
Thank you, Chairman. We now move on to item 14, which is the City of London Safeguarding Quality Assurance 24-25 participation annual report. This is for information on 117 to 138.
Thank you. This is myself. So in terms of participation, our offer is open to anyone who is in care or has been in care previously with the City of London and is still being supported by us. We work hard to make sure that anyone who meets this criteria is aware of our activities and opportunities available to them. We have a very active WhatsApp group, but also make sure we email, ask social workers to promote events and notify care and accommodation providers of activities. And we also have a website to share information. We continue to promote our activities through our commissioning reviews with care providers and our quality assurance visits that I've just spoken about. Given we have small numbers of children in care this year, and some of those live at quite a distance, our main attendees have been care leavers. The majority of our care leaves are unaccompanied asylum-seeking young people, so we need to think in terms of preparation with English as a second language to support them to give additional time to support in conversations and preparations in order to promote inclusion, especially for those who may have recently arrived in the country. This year we've been supported by an apprentice from the virtual school who has been able to translate information and has supported explanatory videos into Arabic, as this is the most widely spoken language within our cohort. So this has been incredibly helpful to support understanding and promoting inclusion within this group. However, the group's also a really good space for young people to practice their English in an informal, friendly and supportive environment. So this year we've really focused on having consistent monthly opportunities to get together, either through online information sessions or our supper club. We ensure that there's an annual residential trip and activities during holiday times, although we're acknowledging that it's holiday times are slightly harder with our cohort of young people where more are working or having different educational break times. And that our cohort is getting older and more independent and self-sufficient, which whilst that's a really positive thing, we need to think about how we're able to engage and support them. And just to say, we've also confirmed our residential trip for this year, which is happening at the end of the month for our group. So throughout last year, 123 attendances at Children in Care Council events, which given we're kind of working with an average cohort of 55 children in care or care leavers is pretty good. We tend to have a fairly consistent core group of young people that attend events, and those that attend give really consistent positive feedback. So looking towards this coming year, we will be looking at the review of the remit of the role. There's capacity that can be utilised in other ways, and we might be looking at reviewing some of our commissioned external services and whether we could bring those into that role, and also bearing in mind the Families in the City programme of work and how participation could be widened across that cohort and in that hub model. I'm happy to take any questions.
Any questions? No. I only have one, which is a bit not such a serious question, but I just wonder how you're going to match the sailing residential for this year, because that was so successful.
It was. I'm not sure I am, in all honesty, but no, we've got a residential trip booked, as I said, for the end of the month. Again, thinking about what's reasonable for young people when they are trying to balance work and not wanting to lose money. So we're going slightly more local. We're in Ashford in Kent this year, but it's a PGL, lovely old stately home, acres of land. So hoping that young people enjoy it. We've already got a number of young people signed up and we'll be encouraging others to attend. But yeah, it's not going to be a sailing trip this year, but yeah, we can plan for the future.
Okay. Any questions from anybody? No. Okay, great. Well, thank you very much indeed, Laura. Let's move on then to item 15.
Thank you, Chairman. Item 15 is the City of London DCCS 24-25 Local Authority Designated Officer Annual Report. This is for information on pages 139 to 154.
Fabulous, back to me. So in 2024-25, we had 122 LADO contacts, which was a 65% increase in contacts of the previous year. I would say across London and nationally, LADO contacts are increasing. The sectors with the highest level of contact were other LADO or other local authority, which given the size of the city and the multiple local authorities we're bordering, there's often discussion about jurisdiction and responsibility of where things may fall. It's also particularly prevalent for the city as we have several head offices of agencies, employment agencies based here. So whilst professionals may not be working in the city, their agency employer is located here, and therefore the employment responsibility falls to myself as the LADO. The next highest category was other at 16%. So this was a range of things that could compromise contacts from members of the public, parents or employees themselves. Just to reiterate, members of the public cannot refer directly to the LADO. This should be done through the employer, nor does the LADO communicate directly with any individual who's the subject of an allegation. That's the responsibility of the employer. Following this, we had education, primary at 11 and higher education at 10. And I'm happy to have consistently high contacts from education providers. In my view, that's positive, given the amount of time children spend at school and often the complexities they bring with them. I'm happy that schools want to talk things through with me. I think that's really good. So I'm hopeful that that means that we've got positive relationships and they feel they get helpful advice from coming to the LADO. The highest contacts of concerns were relating to personal life. Then this was followed by sexual concerns, and that covers both recent and non-recent, and then professional conduct. In terms of personal life issues, these are really varied, but often range from domestic abuse, mental health issues, substance use, relationship difficulties, and we have seen a bit of an emerging trend this year around online dating sites and potential exploitation through that or violation of privacy. So of the 3 cases that reached LADO threshold to go to an allegations against staff and volunteer meeting, 2 were in relation to teaching assistants, both of a sexual nature, both agency workers working in schools outside the city. 1 was substantiated and the other was unsubstantiated in those matters. The 3rd threshold allegation was around a physical incident in a professional's personal life in relation to their own child, and that was substantiated as well. So in terms of LADO training, we deliver ongoing sessions through the Safeguarding Partnership with my Hackney LADO counterpart, and again get very positive feedback in relation to that and have dates booked throughout the year to continue that. This year also we've been focusing on reminding employers of their legal duty to refer to the DBS in cases of a substantiated allegation, and we developed some guidance with our London DBS coordinator to support this, which is now on our Safeguarding Partnership website. But happy to take any questions that you might have.
Anne, and then Steve.
Thank you for the report. I mean, the 65% increase is way above the national increase, and I know there has been an increase across London. So that 122, I think you explained it's because we've got head offices of particularly employment agencies in the City of London. Is there any one agency, and this may have to go into non-public, that's overrepresented in this 122?
No, there's no specific agencies that are causing me concern in terms of the number of contacts that have come through to me. The other thing I will say in terms of that increase is potentially down to some changes in recording all the contacts that come through to me. And also we have seen an increase across the London LADO network of sharing concerns around individuals or agencies to seek information about whether they've ever come to notice in your local authority. And I do document all of those so that I've got a list, so that ever if that name did pop up, then I can look back and reference it. So I think I've changed slightly how we're recording all that information. So I'm not concerned about the increase, although I know 65% looks hefty.
Steve?
Yeah, I don't quite, so firstly, maybe I should know this, but you said that the two of the issues were schools outside of the city. So why were we doing that rather than the, well, I should too. Why were we doing that rather than the authority? And the other thing, which I think has been an issue generally, is just how clear we are that if follow-up is required, i.e., you know, a teacher assistant was found to have done something inappropriate, how do we know that that person, the information about that person will go to wherever they might try to get employment from next?
Absolutely. So first off, the reason that those 2 incidences came to me was the head office. They were agency teaching assistants working in schools outside the city, but the head office was based in the city. So the local authority where the schools were based were involved in those meetings and the actions from those meetings, but I was the lead LADO as where the employment was based for those individuals. Yeah. So second, in terms of making sure that individuals can't then move on, and we've tracked actions. It is, so we make sure that's one of the reasons we were stressing the DBS referral, that if we've got substantiated, we want that to be a measure so that people can't move on. So that's one of the reasons we're stressing that. It is a challenge. So the person who was unsubstantiated could go and register with another agency. There's nothing we can do about that. And references don't allow you to disclose unsubstantiated LADO concerns. Only substantiated LADO concerns are disclosable by references. But we do make sure, I always stress with employers that they should be saying to the individual they have a duty to notify any future employer that they have a substantiated LADO allegation, but the reference would also be the other way of doing it, and the DBS referral.
Yeah, no, I realise it is difficult. I suppose that's the other issue then, isn't it? Because if I run an agency trying to get my workers into schools or wherever else, then I'm going to want as many people to join my agency as possible. So I suppose that follows on from maybe what Anne was getting at, is whether there are agencies based in the city that we should have conversations with about making sure that their recruitment policies are the sort of the level that we'd expect schools or other institutions to.
Absolutely, and that's something in terms of our discussions when concerns arise. We do go back with how did this individual become employed with your agency? What were your reference checks? What was the DBS saying, etc., etc. And that's part of it. And there may be recommendations from findings around the processes in agencies. As I said, I'm not having repeat offenders, if you like, in terms of agencies at the moment. However, I am very keen to try and be getting contacts within agencies to be inviting them on the LADO training that we run. So the more I have contact with these agencies, the more I can build up that and try and get them included in that. It's an area for concern around LADOs in London and nationally. And again, that's one of the reasons why LADOs do often reach out to the London network to say, have you come across this agency or have you come across this individual, so that we can be sharing that information.
Yeah, I think it's, if you're very determined as a professional to get into a school by an agency, you'll find a way in, but it's about schools having robust procedures and practices in place. So it is the school's responsibility to make sure that all the staff are properly supervised. So it's not just the agency's responsibility. That's what I'm trying to say.
Yeah, no, it's absolutely combined. And again, that's one of the things being stressed when we've been having some of the meetings, is who is providing the safeguarding training for these individuals, etc. And the level of supervision and support for new members of staff coming into schools, and the reporting procedures for children if they feel uncomfortable with any members of staff.
I just have one final question for Laura, which is about the looking at the types of concerns raised. I was just wondering if there is any relationship between those types of concerns and social media, and what we're hearing about the use of young people and social media, and how much that is influencing some people's behaviours.
We've definitely had incidents of social media being used inappropriately by professionals to reach out to children when they shouldn't be. As I said, there have been incidences where professionals have been potential victims of crime through social media and online platforms, etc. So, you know, I think it is a wider issue in terms of personal life as well, relationship breakdowns, harassment, etc. So it is definitely creeping into the world, LADO world. Whether or not it tallies completely with what we see in kind of social care and the issues for children, I think it's slightly different. But yes, there are issues as well for adults around how social media impacts their mental health and well-being, and therefore their capacity to fulfill their functions.
And so is there anything more that we should be doing as, you know, as a corporation and being responsible for LADO and service and support?
Not off the top of my head. I think schools are generally pretty good about having quite clear social media policies for their teachers and employees in that space. I suppose it is always about adherence to those in the settings and outside of it, but nothing that's coming up that I can see particularly in the City of London, or that's coming up as a London concern.
So just to follow this through a little bit, is there any, who else sees this report? So for example, would COLAT see a report like this so that any action around social media? I mean, I'm sure all of the academies and other schools have got policies around this, but if we're seeing a pattern, should we just be saying we're seeing a pattern? You're probably on top of it, but to make sure that there's that connectivity through different arms of the City of London's responsibilities.
So they haven't seen the full report. However, I took an overview to the Education and Safeguarding Forum and speak that through. So I go there every term, is it Kirsty, that we hold the meetings and give LADO updates. So any themes we're seeing in real time get reported back to the schools and the DSL leads there, and the overall annual overview gets reported back.
Okay. Kirsty?
Yeah, so just to add to that, I was going to mention that if Laura hadn't, but we also have, because of the working together work to improve school attendance, which I know this isn't attendance, but we have got a very good working relationship with our dedicated safeguarding leads at the school. So our education welfare manager is working with them to have a more operational group. It is called the Network Attendance Network meeting, I think, but we are looking to expand that so that all the schools in the city can come together and share that operational best practice, because obviously there's the Safeguarding Education Forum, which is a bit more strategic. So we're very much aware of the fact that there could be some really good practice that's going on around things like social media concerns and things like that. So that is something that we are very much, especially this academic year, we've been working to kind of solidify those kind of working practices in the schools, and for us to be a part of that as well.
Okay, well, Steve, the incoming chair of COLAT, so I'll leave it with Steve to decide whether there's anything more that needs to be said or done, but the point's been made. Thank you. Okay, let's move on again then, on to item 16.
Thank you, Chairman. Item 16 is City of London Children's Services Practice and Impact Review Summary Report from September 24 to February 2025. This is for information on 155 to 170.
Back to me. Okay, so as part of our ongoing quality assurance framework during the 6 months from September 24 to February 25, there were 10 practice reviews completed. So ADAO, an independent company, conducted 8 of those, and 2 were completed by internal staff, which was one myself and Ria sitting next to me. So out of these 10 practice reviews, the quality of social work practice is consistently graded as outstanding in 80% and good in 20%, which is really reassuring in terms of the quality of provision. And this quality of practice led to outcomes for children and young people being rated as outstanding in 60%, good in 20%, and requires improvement in 20%. So that was acknowledging that despite best efforts of social workers, outcomes from children and young people can sometimes be variable depending on other push and pull factors that might be going on in their lives and needs that they might have. The practice reviews look at the work on our electronic recording system initially, and this is then triangulated with feedback from children, young people and their families, the allocated worker and the line manager. So I know practitioners and managers are really welcome and constructively engaged in this reflection and evaluation of their practice and considerations of how this could continually be improved. And it's also when we are able to get feedback from children, young people and their families, that's really helpful in order to understand their day-to-day experiences of our services. The inclusion of a consistent moderation process has helped strengthen the practice review process. So that is, it helps us as senior leaders consider the daily experiences of children and our families who are accessing our services, and making sure that we have clear and transparent sight of the operational functioning of the service, and also helps the discussion with our independent or internal reviewers about what does good look like, what does outstanding look like, how can you continue, how can you make good outstanding, and how can you make outstanding even more outstanding, you know, and where social workers are doing all they can, but we still might not have the outcomes we want for young people. How might we draw in partners or others, or think creatively about what we can do differently to try and improve those outcomes? So happy to take any questions on that.
Any questions? No. Okay, Laura, we'll move on then to item 17.
Thank you, Chairman. Item 17 is the City of London Department of Community Children's Services 24-25 Private Fostering Annual Report. This is for information on 171 to 182.
to me. Okay, so notifications in this area remain low, which again is a national trend in terms of reporting around private fostering. So we have tools and resources available for professionals, for parents and carers to help them identify when private fostering might be taking place. We regularly raise awareness with our partners and internally about what private fostering is, how we might identify it, what to do when we do identify it. That's consistent and ongoing. We also take information about private fostering to our corporate induction events, etc., and our people's induction so that partners are aware. We're currently working on refreshing our website and leaflet information to ensure that it's as engaging as it possibly can be. And once that's done, I intend to do a mail out to our partners so they have leaflets, they're reminded about their obligations. We do have a private fostering day held each year, so we make sure there's internal communications around that and signpost any training. So it's just an ongoing awareness raising in this area. I don't have concerns that partners aren't aware of how to identify private fostering or what it is. It's just, as I say, nationally underreported, but we will continue to do all we can to identify any arrangements in the city.
Great, thank you. Any questions? No. Okay, great. Well, thank you. Let's move on.
Thank you, Chairman. Item 18 is questions. I've not received any in advance of the meeting. And item 19 is any other business. I believe there's one item of AOB. Chris, I'll pass over to you.
Thanks, Blair. I think Mandy is still on the line. We wanted to, there was 2 points, if that was okay. One was in relation to the Casey review, and the other one was in relation to the Child Q and the completion of the disciplinary proceedings that took place last week. But Mandy, if you're okay to come in, give members an update in relation to the Casey review implications for the city.
Yeah, thank you, Chris, and thank you, Chair, just for the opportunity to give you an update. Obviously, just given this in the context of contextual safeguarding in relation to the release of Baroness Casey review and the vulnerability that comes with child sexual exploitation. So as many of you will be aware, Casey review was made public 2 weeks ago now. Still working through, so policing in short are still working through the recommendations that have been made. One key recommendation within all of that was the establishing of a central team overseen by the National Crime Agency to investigate both legacy and ongoing group-based sexual offending. We have had a letter of assurance from the NCA and the NPCC that design process is underway, along with demand analysis and the bringing together of resources for what that looks and feels like. But as you're aware, the context of the report really critical towards policing and the whole system response to group-based sexual offending, contains a number of recommendations. I've covered one main one there. The other key one that's coming out will be that full national inquiry and agreement for government to commission that. The report itself made direct reference to ethnicity of offenders. Obviously, policing have been monitoring that and the impact of that over the last 2 weeks, and thankfully that has not come to any kind of fruition in terms of right-wing groups or others exploiting that, and there was a fear and an assessment at one point that there may well be national unrest in relation to that, but I think geopolitical events has overtaken that somewhat in the interim. So our current position is both City of London Police and the NPCC will sit now and reflect on the recommendations that's been made and continue to work through them at pace. We'll continue to link in, so City of London Police will link in with the national team, so we are fully aware of the situation and actually how we're going to implement those recommendations when the direction comes. But in terms of the context of the operating picture and the threat, harm and risk picture here in the city, is that City of London Police do not have any legacy group-based sexual offending investigations over the last 5 years that will be part of this review or have been part of this review. We've completed a full audit in that regard, and we've reported that back into the National Centre. We did that actually some months ago as part of the Baroness Casey review, so we did our return. The second part of that, which is really important to understand, is that we have got no live investigations that result in group-based or indicate group-based sexual offending in the city. For assurance, we completed some deep dive work, which I presented at various forums, and happy to do that either in this forum or other forums where anybody thinks it's going to be applicable. But a deep dive analytical piece of work into what the threat, harm and risk picture looks like, both in terms of group-based sexual offending in the City of London and actually more broadly child sexual exploitation and criminal exploitation in the square mile. So that piece of work has been done. And we've identified a number of intelligence gaps which we'll work through both with police and across partnerships. City of London Police at the moment have got a full communication strategy. Again, we'll be guided by the national team in relation to that, but there have been no inquiries to date. And again, pleased to sort of just reinforce that there's no national or local community tensions in relation to some of the context of the report. And the work within the city in terms of recommendations and implementation, both here and across the partnership, I will be leading on behalf of the City of London Police. But of course, our methodology, as always, will to be work in partnership with both City of London Children's Services and Hackney Children's Services to make sure that we maximise all the opportunities that the recommendations bring. So happy, I know that's a bit of a whistle-stop tour, but if I'm open for any questions if anybody has any.
Thanks, Mandy. That's really helpful. Any questions, anybody? No. Okay, that's great. I think it was really useful, and I think that if we think that we need to have a fuller report back here, Chris will be contact you, and you can talk about how to do that. Okay, so there's the child queue.
Yeah, I mean, I don't know if Mandy, you want to come in on the back of this, but just to update members, you would have seen the publicity last week in relation to the conclusion of the disciplinary proceedings in relation to officers involved in the child queue search that took place in Hackney. A correspondence went out from our Independent Commissioner for Safeguarding Children Partnership, Jim Gamble, to all partners, reflecting that outcome and recognising, most importantly, the ongoing work that partners need to engage with and in relation to issues around systemic racism and anti-racist practice. From the perspective of the City of London Directorate, I just to offer some assurance that this is work that we've been engaged with for some time. You would have hopefully have heard today through some of the reports the commitment that we place in relation to addressing issues around EEDI, and more specifically, in addition to that, we are as a department engaging in training around anti-racism. All senior leaders took part in cultural competency training last year, at the end of last year, and starting in the autumn, all members of staff in DCCS will be engaging in anti-racism training. That's just being finally commissioned and confirmed in terms of the provider. We also have now signed up to the Social Care Workforce Race Equality Standards Programme, which is run by Social Care Institute of Excellence, which will help to understand and gather more intelligence in relation to the experience of colleagues who are from the global majority working in the department, and will provide updates back into this subgroup in relation to any implications of that for our staff. And for members who may not be aware, we also have our own EEDI group in the department that's chaired by 2 members of staff, one from the senior leadership, one from the team manager. So these are just examples of some of the work that we've been engaged in over the last couple of years in relation to work around anti-racism, which is indirectly linked to obviously the issues that have been raised through this case and the findings that came out of it. I don't know, Mandy, if there's anything you want to raise or add specifically in relation to the police aspect.
Yeah, sure. Thank you, Chris. And again, thank you, Chair, for the opportunity. Just in terms of the work that has gone on that Chris has outlined, that is also sort of reflected the impotence of work that has taken place across City of London Police. Various safeguardings in custody, just specifically in relation to the searching of juveniles and young persons. That's critically important, and that's been in place sort of predates the recommendations that formally came out of the child queue review, and of course we accept them in their entirety across policing in any case. Secondary to that, we've also got the Stop and Search Scrutiny Group, where both the quality and the application of legislation is of course under a lot of scrutiny, but also is the proportionality or disproportionality figures that may come about. And really pleased to sort of say that City of London Police have got some of the lowest disproportionality figures in across England and Wales, across forces, and was something that was specifically looked at in our most recent HMIC Peel review, the full public report of which will be available. I think it's anticipated the week beginning the 24th of July, which should give members of this board and beyond the reassurance that it needs in terms of stop and search and the application of legislation across the City of London, and of course the scrutiny that comes with that as well. And then notwithstanding, of course, the more broader work that goes across in terms of our pledge, in terms of our EDI strategy that was launched by the Commissioner last year, then that is also part and parcel of our strategy going forward over the next 3 years, to make City of London Police one of the most inclusive police services across England and Wales. So all of that is tied in, all sequenced, and also mirrors the work that has gone on across the partnership as well. So again, hopefully brings some reassurance of where we're at. In terms of the child queue misconduct outcome, so of course the decision has been made that the officers involved, Metropolitan Police officers involved, have been found, there's been a finding of gross misconduct. I think from the update from the exec, and Chris, please correct me if I've assessed this wrong, is that the actual outcome of that, so whether that's dismissal or another sanction for the officers, will be not for another week or so yet. And of course, City of London Police were tied into the comms strategy that is part and parcel of that. And I've also shared the comms that came out from the partnership as well, Chris. So Glenn Seabright, our comms lead, has got all of that as well, so we should be tied in, but we would request if there is going to be a decision to make any kind of partnership announcement or piece into the media, that we tie in Glenn, so we can do that as one collegiate. That'd be really helpful, thank you. But nothing else from me.
Thanks, Mandy. Any other comments? No.
Just say, Chair, that Anne and I have to go to find the spaces,
I
so
know.
we just need to leave, I'm afraid.
Thanks very much, Mandy. We have got the appendices in non-public, and we had the minutes to agree, and we got a review of annual report from independent reviewing officer, which is an information report. So I'm going to propose that we just take that as read, and if there are any other comments on the appendices and the data, that you go directly back to the relevant officer. So I'm sorry about the truncated end of the meeting, and I know the room has to be.
Before you leave, could you agree the non-public minutes, please? Yes. Thank you.
Yeah, thanks very much. So sorry people are being truncated, but thanks very much. That's the end of the meeting.
Thank you. We'll now end the live stream.
Thank you.
Thank you, Chairman.